Hi and welcome to the vlog. I hope you are all well. I'm Tova, this is Parentxp, and this is another perimenopause vlog all about sex. So, little quick warning, this vlog is definitely not aimed at children, not suitable for children, it is not safe for work, and if you are a person that feels uncomfortable with the use of anatomically correct terms, then it might not be the vlog for you. For all the rest of you, come on in, let's have a personal conversation. I got this idea, and now my cat is standing on my notes. I got this idea for the vlog of a comment on one of my perimenopause shorts that I post here on YouTube. And the comment was as follows. My life has been ruined by getting involved with someone who, as soon as menopause hit, totally cut off sex. I'm tired of women making excuses for it. If you don't like sex, remain alone. Oh, there is so much we could get into here, isn't it? I could spend hours breaking apart this comment and talking about it. I'm gonna try to dial it back a little bit and just say that the comment surprised me because that little video did not mention sex. As a matter of fact, I have not mentioned sex in a single one of my videos about perimenopause. Not a single one. It's not a topic I've touched on at all. But I thought maybe it's time to rectify that, so let's talk about sex. Now, are you getting snuggles or not? Because it feels like you want snuggles, but it also feels like you can't quite make your mind up. In or out? Out for now. She might come back. Hormones play an enormous part in women's sex lives throughout their entire lives, and our libido ebbs and flows. Okay, that's just how it is. As women, we go through a period where our libido is lower or non-existent, and we go through periods when our libido is higher. And there are so many reasons for that, and a lot of those reasons are hormonal. For example, pregnancy and childbirth and breastfeeding can have a huge impact on a woman's sex drive. It doesn't always, and it doesn't always go the same way. We don't all follow the same rule book. It's not, here is woman does this. I have friends who, after they had a baby, were as up for it, if not more, as they were before, and I completely lost my libido. Particularly after Elin's birth, it was gone. And of course, and I'm not saying that this had anything to do with it, it didn't actually, but if one partner has lost their sex drive and the other one hasn't, then that puts a certain strain on the relationship. Now, as I say, it didn't have anything to do with why my children's dad and I parted ways. But if in a relationship, one partner is not into it and the other partner really is, it does put a strain on a relationship. And during perimenopause and menopause, a lot of women aren't into it for so many reasons. And one thing I'm going to say here, and this is kind of touching back on that comment, is you do not owe anyone sex. You don't owe your partner sex. You don't have to have sex. You do not owe anybody sex, but you deserve a good and enjoyable sex life for your own sake, is what I would say. So, we're going to delve into a little bit why perimenopause and menopause affect women's libido and genitourinary symptoms of perimenopause and menopause. God, that's a big word. Because there's a lot of them, and I haven't mentioned them in any of my previous peri vlogs. Personally, I don't actually have a problem with these symptoms, which is one of the reasons I haven't spoken about it, because I don't really feel like I can bring personal experience into it. There are fantastic resources if you are interested in finding out more. If you want to find out more and have a good old belly laugh at the same time, then I recommend a podcast called My Aloof Vagina, because that one's good and funny. There's another one called Perimenopause WTF, and they come up on YouTube as well as podcast platforms. Both of those two are American. If you want an English one, and again, you've got both podcast platforms and YouTube, then I really recommend Dr. Louise Newson's podcast. And you can get so much information about what it is, why it happens, and what you can do about it. And I will touch a little bit on those things, but really, if this is an area where you struggle, those are 3 fantastic sources for getting loads of information. So among the common perimenopause symptoms that have an impact on your sex drive are, first of all, the fact that your hormones are all over the place and they are going downhill. They don't go downhill smoothly, they go like this, but steadily downhill. You are, throughout perimenopause, you are losing the amount of estrogen in your body, the amount of progesterone in your body, and the amount of testosterone in your body. Yes, women have testosterone. It's a super important sex hormone in the female body. It's not just a male hormone. And most experts agree that the one that really, really has a huge impact on the sex life is testosterone. If your testosterone is super low, that is likely to put an end to your libido. Estrogen also has this impact, but testosterone is the big one for it. Which is a little bit annoying because here in the UK, you can easily get estrogen and progesterone on the NHS. Getting testosterone is a little bit more difficult and might require seeing somebody private unless you've got a really good NHS GP. And then, of course, you get genitourinary symptoms in menopause, and these are directly linked to the estrogen, actually. But common perimenopause and menopause symptoms are issues with bladder incontinence, a dry vagina, clitoral atrophy, that's a doozy, and painful intercourse. And of course, if your vagina is very dry, then intercourse is likely to be very painful. And if your clitoris is atrophying, that means you don't have as much blood flow to it anymore, your nerve endings die, things just aren't as pleasurable anymore. And estrogen is the body's lubricant. Estrogen lubricates and moisturizes your entire body. It keeps your skin supple. It keeps your vagina moist. I went there. It keeps your eyes hydrated. It keeps your mouth hydrated. So you can get dry eyes, dry mouth, dry nose, dry skin, dry hair, dry vagina as your estrogen levels go down. And then, of course, you have other perimenopause and menopause symptoms that will affect your sex life. Anger and irritability, I think, are huge when it comes to this. I know that my anger and irritability has mostly gone out over my kids because the poor buggers are the ones that are here. But if I was living with a partner right now, I can absolutely assure you that that poor person would bear the brunt of all of that anger and irritability. And if you're annoyed at the person next to you for even breathing, you're not going to let them come close to you and have sex. Are you? And if you're anxious about a lot of things, that's not a particularly sexy feeling. Stress and sex do not go hand in hand. What? Excuse you? Excuse you? No stressed woman has ever been up for it. We just aren't. They are not things that are compatible. Stress and sex, not a good combination. It will not happen. And then, of course, your body confidence might be gone during this period, particularly if you're one of those women who have put on weight. who are sprouting hair in places you've never been hairy in before, where your skin is dry and lizard-like and flakes off you and your hair is falling out in clumps. I mean, if you don't feel happy in your body, you're not going to feel particularly sexy. So all of those things put a spanner in the works when it comes to sex in perimenopause and menopause. And as I say again, you don't owe anybody else sex, but you deserve to enjoy sex life. And there are so many things that can be done. I feel like this is very suggestive. Mr. Bond, I want to talk about your sex life. What is my brain doing? Oh, Lucas like, fuck this, I'm out of here. If you want to have good, enjoyable and pleasurable sex, but you are not for all of these reasons, what can you do? What can be done? What can your partner help you with in order to get back to that place where sex is fun and good? So first of all, there are lubricants. And now here is where I really, really, really recommend that you go and listen to Dr. Louise Newson's podcast or My Aloof Vagina and get some suggestions of good lubricants that are the correct pH for your vagina and vulva, because you shouldn't just use any old lubricant. We're not talking about the sex toy silicone stuff now. We're talking about stuff that is specifically designed for your genitals. It's a very delicate balance down there. You don't want to mess it up, because then you get a white Christmas and not the good kind. So yes, the correct pH balance, lubricant, moisturizer for your genitals, something that's been designed for that area. They are out there. You can buy them over the counter. There are also lubricants that contain estrogen. And this is not the same as hormone replacement therapy. This is not the same as transdermal estrogen. So if you don't want to or you can't have transdermal estrogen for any reason, chances are you very often can still have an estrogen-based lubricant for your vagina that only adjusts the estrogen levels there and really helps to re-moisturize, replump, if you like. And again, go to these other sources because I'm not an expert here. And as it's not an area where I have issues, it is not something that I've really focused on in my research. There is, of course, hormone replacement therapy. And as you know by now, I am on hormone replacement therapy. So I have estrogen and progesterone. I do not have testosterone. And one of the GPs I spoke about on one of my HRT updates at my GP surgery was quite dismissive about testosterone. She kind of threw out a little comment about how it was really not necessary. Based on what I can hear and what I read and what I find out, it actually feels like testosterone is playing a really important part. And if you think that your testosterone levels are really, really messing with your libido, it's well worth asking about it, asking for a second opinion, even trying private if you think that is what's going to make a difference for you. For a lot of women, it's made an enormous difference. Healthy fats. Lots of healthy fats in your diet. Moisturize your body from the inside out. Nuts are really important here. Evening primrose oil supplements can make an enormous difference. A friend of mine recommended that I start ingesting extra virgin coconut oil every day. So every day I have a spoon of extra virgin coconut oil in my coffee, and it has actually made a difference to my skin. My skin is significantly less dry and itchy since I started doing that. And she got that tip from an American endocrinologist. Get your fat balance in your body right. And we're so afraid of fat, which I think is a real shame, because fat is actually quite good for you. We're talking about polyunsaturated fats here, nut oils, nuts, extra virgin vegetable, that kind of stuff. Not margarine. So the coconut oil one is one that I have tried, and for a few months now I've been having 2 cups of coffee a day, 2 teaspoons of coconut oil, 1 in each, every day, and I really do feel that it's made a difference to my skin. And then comes a phrase that I have found so funny, and it's use it or lose it. And this comes down to the clitoral atrophy. If your genitals are atrophying for lack of use, start using them again to stop that from happening, or to stop that from proceeding. If they haven't yet atrophied from lack of use, again, keep using them. Use it or lose it. But of course, no woman is going to enjoy just having a fiddle if they're not in the right mental state for it. And it can be very, very difficult getting in the mood. As I say, stress and sex do not go together. If you're stressed and anxious, getting yourself in the mood is going to be really, really hard. But if you can, try and carve out a little bit of me time, you know? Read erotic literature, things that turn you on. Fantasize. In your head, you can go there. You can go wherever. It doesn't matter how shocking or different or whatever it is. It's inside your head. You can think about it. And if it turns you on, do something about it. Explore how you can play with yourself. There are so many fantastic different ways to masturbate. There are so many fantastic different sex toys out there. And really, you know, you have a chance of getting back in touch with your own sensuality and your own sexuality. And you're doing it for a good cause, right? Because you want to use it so you don't lose it. Yeah? Or you can almost take your partner out of the question and just rediscover sexual desire for yourself. And when you do that, it's very likely to have a positive impact on the sexual desire between you and your partner and boost that part of your relationship. And again, that first podcast that I mentioned, My Aloof Vagina, there are loads of episodes that deal with exactly this. There are different sex therapists who are coming on and talking and just sharing things you can do, ways to play with yourself, play with your partner, just bringing that frisson back into your life. And, you know, it's not all bad news. Not all women lose it. I can't remember the exact percentage now, but there is a significant percentage of women who enjoy a really active and fantastic and brilliant sex life after menopause. And I sincerely hope I'm one of them. And I wish for you that you're one of them as well. And I don't think that it has to go. Of course, if you really don't want it, if you're really done, if you do not care what you lose down there, absolutely, you know, be content with that decision, because it is your body, it is your life, it is your mind, it's your well-being. But I think if you mourn the loss of your libido, if you wish you had a fantastic sex life still, if you want those things back into your life, then all of this is stuff that you can try. Thank you so much for watching, and I'll see you again very soon. Bye.